Introduce to you the first speaker of the day, our keynote speaker. In her memoir, Crash, A Mother, a Son, and a Journey from Grief to Gratitude, Dr. Carolyn Roy-Bornstein describes the balance between being a mother grieving for all her son has lost and a physician to turn tragedy into opportunity. There's a quote from Lee Woodruff, who co-authored with her husband Bob Woodruff in An Instant. She says that Dr. Roy-Bornstein reminds us with heartbreaking prose that life is a journey and a mother's heart is a powerful weapon. So we're very grateful to have Dr. Roy-Bornstein here with us. So please join me in welcoming her for our opening speaker today.
There is this point that divides my life into two unequal parts. A line like a crack in the glass, which carves time and events in two. Those that occurred before the crash, and those that tumble and falter in its wake. There is this one moment in which nothing is the same. It occurs in a heartbeat, a squeeze of the ventricles, a throb, a pulse beat in which blood is pushed up from the heart and into the brain, transforming a potential space into a gooey hemorrhage. In this moment, a skull has careened through space and collided with glass, forming the crack that now divides my life in two. I'd like to thank Teresa for that introduction, and I'd like to thank Kelly Boudelaire here and Patty Carlson for having me as an ambassador for the Brain Injury Association. And a big thank you to Nicole Gaudier and her entire team who puts on these fantastic conferences year after year. Oops. So those words I just read to you were from the prologue to my book, Crash, A Mother, a Son, and the Journey from Grief to Gratitude. And that crack in the glass was very real. In fact, a few days after the crash, a police detective from the crash reconstruction site came to my house and asked me to pluck 25 hairs from my son's head so that they could match them to the hairs that were sprouting from that crack in the windshield of the drunk driver's car. But in the book, I use a crack in the glass as a metaphor for all of the dividing lines that families of survivors of traumatic brain injury face between before and after, then and now, past and present. Because I can tell you that as an ambassador for the Brain Injury Association, as I travel across the state and meet families of TBI survivors, every one of them can tell you the exact date of their fall or their stroke or their accident. Every one of them can tell you the exact moment that their life cracked in half, like mine did. So over the next hour or so, I'd like to take you on a journey. And the journey begins on the night everything changed for my family. But thanks to the power of words on a page, it ends with a new beginning for my family. I'll try to share what I've learned about the transformative power of words, both from writing my book, but also I'll share with you some scientific studies that have actually been done looking at the power of words and the very physical, real benefits of writing. And then at the end, I'll do a short reading from the book. Sound good? So my brain injury journey began 10 years ago, actually, when I got the call that every parent dreads. My son, Neil, was 17 at the time, and he was dating a girl named Trista, and they had a study date at my house, and they had left about 40 minutes prior to the phone call, and we only live a quarter mile from each other, so it usually only takes about 15 minutes. So when Trista's mother, Mary, called and said, "Where are the kids?" I said, "They should have been to your house by now." "Why?" 2 kids were hit on Ferry Road, she told me. So I started running. I ran all the way to the crash scene, but the ambulance had already left. And a neighbor took me to the emergency room, where I gave my name to a nurse behind a little square glass window in the triage booth. That was the first of many partitions that would separate me from my son. So they finally took me to his cubicle where he was in the ER. They told me his only injury was a broken leg. They told me they were going to do a CAT scan of his head just as a precaution because he was unconscious at the scene. Well, his broken leg would turn out to be the least of his problems. His brain was bleeding, and we were going to be transported to Boston to intensive care unit. So I rode in the front seat of the ambulance, and I'm a doctor. That's definitely not where I'm most comfortable. I'm usually in the back with the patient. And again, I was separated by a little square of glass. I could see my son back there, but I couldn't hear anything. It was a little like watching a television with the sound turned off. So the next dividing line came when we arrived in the ER in Boston, and I was not allowed to be in the cubicle with my son. I was taken out to the waiting room, and the waiting room was very crowded with patients, with crying children and pregnant women and old men. And I immediately felt a kinship with these other patients. We were all waiting, either waiting to be seen or waiting to be let in to see our loved ones. So they finally came and got me and told me the rundown of what Neil's injuries were: a fractured skull, subdural hematomas, subarachnoid bleeds, contusions in the frontal lobes of his brain, and they were going to be admitting him to the trauma ICU. They brought me in to see my son. He was not awake very much. He would only rouse when you jostled his shoulder or called his name. But when he was awake, he was complaining. He was cold. They had used those big ER scissors and cut all his clothes off, and he just had a little thin sheet over him. He had his neck in one of those hard collars, and he was complaining he couldn't move. And he was complaining about the pain in his broken leg. And I tried to comfort him as best I could. I took off my coat and put it over him to try and warm him up. And I tried to reassure him that as soon as the doctors had looked at the x-rays of his cervical spine and determined he didn't have a fractured neck, that they would take his collar off. And I tried putting his leg on a pillow, but none of it was right. None of it helped. Neil was very agitated. He was very confused. First he thought he was in a gym, then he thought he was on a boat. And what I learned a long time later when I started researching brain injury is that what Neil was experiencing was something many brain-injured people suffer, and that's called temporal lobe agitation. And it was very hard to watch. My son is very quiet, very soft-spoken, very sweet dispositioned, and here he was lashing out at the nurses and at me. They did another CAT scan in the ER, and they told me that his brain bleed was stable, that he was not going to require surgery on his head. And I was very grateful, but I was very scared. They took us to the trauma unit where we were again separated from Neil. This time we were deposited in a waiting room, and we were shown a telephone that we could use to ask permission to see our son. He had surgery the next day on his leg, and we waited in the waiting room and worried. His blood pressure had been very low all night, And I was concerned that with his pressure so low, under anesthesia, it would go even lower and he wouldn't be able to perfuse his brain and he would essentially suffer a stroke. That did not happen. He came to us pretty much how he left us, kind of sleepy and kind of confused. So for the next week or so, he had physical therapy. He had more CAT scans every couple of days. They would do a scan of his brain to make sure the bleed was not enlarging. But his efforts were hampered when we had to tell Neil that his girlfriend had died. She did not survive her brain injury. And at that point, my son just kind of checked out. He literally pulled a blanket over his head and said, "I don't want to eat anymore." The orthopedic doctors came and tried to get him back to physical therapy because he was refusing to go, and they said, "Neil, you're never going to walk right again if you don't go to physical therapy." And he said, "I don't care if I ever walk again." And this kind of avoidance, this escape, this tunneling into his blanket with the pillow over his head, I think was a kind of survivor's guilt. He had, after all, survived a horrific accident that his girlfriend had not. And I remember telling him that I felt guilty. I was actually the one who told Neil to walk Trista home. She was all set to go by herself. The kids had some crazy idea that they were going to get Neil to come over to her house for a few more hours that night, and they thought the way to do it was for Trista to arrive before curfew and alone, and then her mother would say yes to this scheme. But I said, "No, Neil, you have to walk Trista home." So off they went, out my door and right into the path of a drunk driver. But when I told Neil about my guilt, I said, "You know, Neil, if it wasn't for me, you wouldn't have a brain injury. You wouldn't have a broken leg. You wouldn't be in the hospital at all." He said, "No, Mom, it's better this way. Because if I wasn't there, Trista would still be dead, and I'd feel guilty for not being there." And for a long time, I thought what I was experiencing was a kind of survivor's guilt by association, because I was grieving too. I was grieving for everything Neil had lost. Not just his girlfriend, but his memory, his executive function, his sense of humor. But I immediately felt guilty for feeling that grief. I told you Neil was under a thin white sheet, complaining of the cold and shivering. But my thoughts immediately went to Trista's mother, Mary, and I thought how she would rather feel her daughter cold and shivering than just plain cold. And I told you how Neil was yelling at the staff and berating the very people who were trying to help him, and how hard that was to listen to. But then I felt guilty thinking of Mary and how she'd give anything to hear her daughter, even if she was yelling. I learned many years later that this wasn't survivor's guilt by association, that there was a very specific term for what I was experiencing, and some of the professionals in the audience may be familiar with this term, but it may be new for some of you. But it's called disenfranchised grief. And disenfranchised grief is a term that's used to apply to a situation in which society doesn't recognize the griever's grief. You see it applied a lot to situations where the grief is not recognized because the relationship isn't recognized. For example, a closeted gay couple. If one member of the couple dies, his parents can grieve, his siblings can grieve, but his closeted gay lover cannot. Similarly with a extramarital affair. If the man dies, the wife can grieve, but the mistress cannot, because society did not recognize that relationship. And you hear it applied to pets. I think society doesn't recognize that animals can be the objects of great love and great grief. But disenfranchised grief can also apply to something that you're mourning that's not necessarily dead, but just gone. And this is where I think it applied to me, that I was mourning for the loss of Neil's maybe personality, some IQ points, memory, sense of humor. You know, what should have been the time of Neil's life. He was a senior in high school when this happened. So prom and graduation. He got into the college of his choice. That should have been heady times for him, and yet it was one long, painful struggle. But as real as those losses were for me, I was guilty for grieving for them. Why? Because society looks at me and says, your son is alive. He survived. I had no right to grieve. Well, it took many years, and I've eventually come to own that grief. A year after the crash, when Neil was having a second operation on his leg during his first Christmas break from college, when 5 years went by and he was still on antidepressants, when 6 years passed and he was fired from his first teaching job because he was too depressed, when 10 years have gone by and he's still suffering anxiety and seeing a therapist, we're still coping 10 years later with the subtle long-term effects of brain injury. I've come to really own that grief, believe me. And that's another thing you family members of TBI survivors know very well, the subtle long-term effects of brain injury. There are things that not everybody would notice, maybe only even a mother notices. Neil has anxiety, but you may not notice that. But I notice. We just had our Passover dinner, and Neil, from time to time, had to keep leaving the room and go regroup and be by himself. He doesn't tolerate crowds, even us, even his family. And the response time. As a mother, I might be the only one who's uncomfortable in that beat or two between the time Neil's asked a question and the time he answers it. A lot of times these problems are things only a family would recognize. I was interviewed recently on Sirius XM radio. It was a health call-in show, and the host was a physician at New York University. And one of the women who called in was a mother of a 10-year brain cancer survivor. Her daughter had had brain cancer, had been treated, and while she was being followed yearly by the oncologist, she was essentially deemed cancer-free and cured. But the mother had begun to notice some subtle personality changes with her daughter. Now her daughter's a teenager, and as a mother and as a pediatrician with a lot of teenagers in my practice, I know all bets are off when you're trying to distinguish between pathology or just being a teenager. They sleep a lot, they slam their doors, they yell, they're moody, so it can be challenging. But I encourage this mother to talk to her primary care physician, to talk to her oncologist. Maybe there was something subtle going on that only a mother would recognize. And that's a piece of advice I have for you today, whether you're a parent or a sibling or a primary care physician, a nurse, or a member of the survivors' rehab team. We all need to be advocates Because when you think about it, by its very nature, brain injury sometimes makes it difficult or impossible for the injured person to even recognize their symptoms. Or if they recognize their symptoms, they're sometimes unaware of the significance, or they don't appreciate how important those changes can be. So we, the loved ones, and the caregivers have to be the noticers and the interpreters of all that subtlety. Now, however we choose to heal ourselves from this experience of brain injury, however we choose to move forward, I think it's really important that we do move forward. Not to gain closure. I think there's something fundamentally flawed with that word and that whole concept. I'm sure we can get closed, but something's always going to come along to rip us open again, right? And I don't know what's so bad about staying open. I think this whole concept of closure is overrated. I think it's perhaps even unattainable, or maybe not even desirable to attain. I don't understand the desire to take an experience and kind of neatly package it up and put it in a little compartment. I think what is more helpful is if we can find a way to live with our new life, our new skills and circumstances, and to find meaning or to make meaning out of what has happened to us. I see people standing, and I just want to mention there's seats up front and over there. You don't have to stand. But for me, the healing and the meaning came through writing. Writing my memoir helped me to see my family's experience in a way that at least started the healing process. And as I go around and do book readings and signings, someone will invariably ask me, was writing your book therapeutic? And if I'm honest, I have to say that actually it was not therapeutic in a cathartic kind of way. In fact, it was more like picking at scabs off of wounds day after day after day, writing. And I think partly it felt like that because of how much time had elapsed before I started writing. I didn't start writing the book until 5 years after the crash. And as you all can appreciate, I was just trying to get through the day. I spent 5 years taking Neil to his physical therapy appointments, to his appointments with neuropsychologists and neurosurgeons and orthopedists, getting him to his therapy sessions, managing his medications. He was on anti-seizure medications for a while and antidepressants for quite a while. Meeting with the school to try to advocate for academic accommodations for him. So there really wasn't a lot of time for self-reflection. There wasn't a lot of time for me to sit and ponder what had happened, or to ask why, or to try to find meaning. Then it was almost 8 years before I had actually finished the book and got an agent and sold it. And then 10 years before I was asked by an editor to do revisions. And as it turns out, I was doing the revisions in January, which happened to be the month that my son's accident occurred. So I was writing about the accident on the anniversary of the accident. And I was writing about Trista's funeral on the anniversary of the day we buried her. And I was writing about Neil's second operation on the anniversary of that, which happened to be a year to the day from his first operation. So it truly did feel like picking scabs. But I think it's absolutely necessary as a writer to have that distance, to have that temporal distance, just to have that time go by, but also to have the emotional distance. You really need that emotional distance before you can effectively grapple with the meaning of the situation, the whys and the wherefores, and to try to come to some satisfactory conclusion or response to what was happening. The British writer Graham Greene calls it the sliver of ice in the heart of a writer. And I think what he was talking about is this need for distance. You can't really write about something when you're in the throes of it, when you're still in pain from it. You can vent on the page, you can journal, and that can be very helpful and therapeutic. But in order to really process the experience, you need some perspective. I teach a personal writing class, and not invariably, but a couple of times I have had students who are trying to write about a divorce or a death in the same year that it happened, and it just doesn't work. You need time and you need distance. So partly too with the timing was again the revisions sort of coinciding with the anniversaries of the date. But I have to say that in retrospect, as I have come to conferences like this and read from the book, I look back and I think it has been a therapeutic experience after all. I feel a little like the writer Dorothy Parker when she said, "I hate writing, but I love having written." Because while writing the book was tremendously difficult, having written it has been extremely helpful in several ways. For one thing, it helped me to really deeply think about these events that changed our lives so completely. Julia Alvarez, the writer, said, "I think to figure out what I'm thinking." And that sounds odd, but it's very true. Just the experience of putting words on paper sort of forces you to organize your thoughts and to sort out all the various emotions that you have as a reaction to a situation. And it allows you to discard some of the less helpful ones like anger and resentment, and to embrace some of the more hopeful ones like resilience and optimism. There's another quote that's a little longer, so I have to read it. I apologize. But Norbert Platt said, "The act of putting pen to paper encourages pause for thought. This, in turn, makes us think more deeply about life, which helps us gain our equilibrium." So putting our thoughts on paper helps us to examine the situation from different aspects or vantage points and to find meaning in a difficult environment. Now notice I didn't say it helps us to find the reason that things happen. And as I've been an ambassador for the Brain Injury Association and gone around speaking to various groups, someone always comes up to me afterwards and says, "You know, dear, things happen for a reason. And you may not believe it, and you may not think that now, but trust me, they do." And I'm just not that kind of person that believes things happen for a reason. I do believe in making our own meaning, imposing meaning on our situation, and maybe I'm just mincing words. Maybe we're actually saying the same thing. But for me, writing Crash was my way of finding meaning in something that was pretty darn senseless. Last spring, I was asked to give a writing workshop out at the University of Iowa, and it was a conference called The Examined Life, Medicine and the Art of Writing. And it was a conference that's geared towards healthcare professionals who want to become writers. And one of my fellow presenters, her name is Nellie Herman, and she's the director of the narrative medicine program at Columbia University. And you may not have heard that term before, narrative medicine, but I believe as family members and caregivers to TBI survivors that you are probably more familiar with the concept than the doctors at the conference. And the idea is this idea of exploring illness and injury through words, through stories, as a way to deepen that experience. So anyway, Nellie had gone through something similarly tragic in her life, and she was trying to write about it. She tried multiple times to write about it as a memoir, unsuccessfully, and she ultimately wrote a novel called The Cure for Grief. And at this conference, she was talking about her experience of writing the book. And she said something that has stuck with me all this year. She said, "We write to exert power over something we can never control, the past." And I think that resonated with me. I just got goosebumps saying it. I really feel strongly about what she said. I think it resonated with me because I think that's exactly what I was doing in writing this book. Because I can't bring Trista back. I can't erase Neil's brain injury, but I can control the narrative. I can control the story. You know, as an author, we make a lot of decisions when we write a book. We can decide where we begin the story. We can decide where the story ends. We can decide which details to include and which to leave out. In my case, I made a literary choice to leave the drunk driver in my book nameless. For 200 plus pages, he's only referred to as the drunk driver. And that felt very powerful to me. I felt like if I were to give him a name, it would make him a little bit more human. And that by not naming him, I made him a little bit devoid of humanity. And it gave me power over him that I do not otherwise have. So I talked about writing as a way to impose meaning on a situation. And with Crash, although it is a chronicle of my son's recovery and his tremendous resilience, it's also my journey as his mother and as a doctor. Because I will admit to you, 650 people today, that I did not know very much about traumatic brain injury as a doctor until it came knocking at my door. And I'll give you an example. Neil was depressed after his accident. No surprise there. He lost his girlfriend. As I said, these heady times of high school were not so heady for him. They were a big struggle for him. So I didn't really think it unusual or out of the ordinary that he was depressed. But then when it didn't lift, I began to realize that his depression was organic, that his depression was a result of the brain injury itself. And I've also learned that this kind of organic depression can be harder to treat than your garden variety reactive depression. So I went on a learning binge. I became an ambassador for the Brain Injury Association. I went to every brain injury conference I could find. I came to the BIA's conference year after year, learning something new every time I came. But I also went to conferences at Boston University, led by Dr. Cantu, who studies chronic traumatic encephalopathy with the athletes' injured brains. And Dr. Meehan at Children's Hospital, who runs the sports concussion clinic. I went to every conference he put on. I signed up for daily updates in my inbox for new medical research in brain injury. I read brain injury blogs by survivors and families. I tried to compensate for everything I didn't know about brain injury by making myself something of an expert. I was trying to impose meaning on what had happened to us and to try to take this obstacle and turn it into an opportunity. But when I was writing the book, I wasn't necessarily thinking about myself or the benefits to me. I wrote the book for two audiences. The first audience I wanted to reach with my book was survivors and their families. I wanted to capture both the enormity of the situation and the subtle layers of the experience of brain injury. And I wanted brain injury families to see the book like a mirror, to read it and say, yes, that is what it was like for me. And the other audience I wrote it for was everyone else in the world, people who did not have the experience of brain injury. And for that audience, I really wanted people to appreciate the very subtleties that brain-injured patients and families can experience. And that people who look fine on the outside may not be so fine on the inside. Or brain injury survivors who look fine on the outside may struggle more than we know. Because when I was writing this book, I had actually more than one friend, close friend, say to me, but Neil's okay now, right? And it's a fair question. He's living independently. He goes to school. He has a girlfriend. But I talk in the book, and I'm talking today about the little things that maybe only a mother sees, that silence between question and answer, or that need to get away. My husband and I find ourselves looking at our son at times, wondering if what we're looking at is from the brain injury, or is that just Neil? Is that just who our son would have become without the brain injury? Now, the book is not the first piece of writing that I had published. I've published a few essays in small magazines or specialized magazines, pieces in medical journals like JAMA, or literary journals aimed at mothers like Brainchild magazine or Literary Mama, magazines that my son was unlikely to stumble across this essay I wrote about him. But I made him read each essay before I published it because I wanted his blessing. I wouldn't be comfortable putting my words out there in the world unless Neil had read them and approved. So he has written everything he's read everything I've ever written about him, and he's been invited to do so. But he's also read some words of mine uninvited. I'll tell you a story. About 3 months after the accident, Neil was still at home recuperating, and I had run out to the grocery store to do some errands. And I came back, and Neil was sitting at the dining room table with a book opened in front of him. But not just any book. It was my diary. And I knew it was the diary that I had kept while he was in the hospital because it had a particular cover, a striking cover. And I panicked, remembering what I had written there. I told you Neil was agitated. He was trying to climb out of bed and trying to take off his clothes. And I was trying to decide, should I let him read my journal or should I say, you know, Neil, it's kind of private. I'd really rather you didn't. But before I had a chance to answer that question for myself, he looked up at me and he said, I'm sorry I yelled at you in the hospital, Mom. Because he didn't know he had. He has no memory of the accident. He has no memory in the ICU. And his memories of the step-down rehab unit are pretty sketchy at best. So I let him continue reading because I realized this was his way of piecing together his own past, that my words were becoming his memory. He also read every word of Crash. I would write a chapter and email it to him, and he would make comments and send them back to me. And the same with the revisions. If I changed something, I would send it. He would look at it and send it back to me. If there was something I thought was particularly sensitive, I wouldn't just email it. I would drive it to him and watch him read it, just to make sure he had actually read it. His responses were varied and always interesting. Sometimes he had corrections for me. He would email me back and he would say, oh, that was a good chapter, Mom, but my graduation gown was actually black, not maroon. I'd say, okay, Neil, thank you. Or he would email me back and he would say, good chapter, Mom, but I don't think you should use the word tertiary. I don't think people are going to know what the word tertiary means. I was like, okay, Neil, but how did you feel? How did you feel when you read it? Because that's what I was interested in. How was he going to feel with this story, these words about him out there in the world? Well, one day he did tell me how he felt. I had sent him the chapter that I just told you guys about, how his father and I will look at him and wonder if something that we're seeing is from the brain injury or if it's just our Neil. And he said to me, you know, Mom, I wonder that about myself sometimes. But then he said, but you know, Mom, I've come to realize that it doesn't matter how I got here. This is just who I am now. From the mouths of babes, right? We're learning from our children. Because he's right. To a certain extent, it didn't matter. It doesn't matter how he got there. It is who he is now. So some of you have already asked me, how is Neil today? And it's been 10 years, and he is in graduate school, I'm happy to report. He does struggle with anxiety, and he does see a therapist. But he started advocating for himself in a way that I used to do for him when he was in high school. He called me up one day and he said, Mom, can I have the CAT scans of my head and my neuropsych evaluations, please? And I said, why? What for? And he said, I'm going to petition the disabilities office at my university, and I'm going to try to get longer test-taking time and a distraction-free environment. And I thought, good for him, good for you, Neil. He was in a roommate situation at the time, and one of his roommates actually had a physical disability. And I said, did you get the idea from Star, from your roommate? And he said, no, Mom, I got the idea from reading Crash. So, because he did not know that I had done that behind the scenes advocating for him in high school. So, writing the book benefited somebody else in my family. First, giving him his memory, but then giving us a way to talk about the injury. You know, it's been 10 years. It's not that easy to just say, hey, Neil, how's your brain injury today? But by me writing chapters and him reading them, it allowed us to rekindle this very important conversation. So I told you I would talk to you about some studies that have been done that emphasize or prove the real physical benefits of writing. There was one study in which patients with chronic illness were asked to write about their illness. Then they were given quality of life questionnaires, and after writing about their chronic illness, they actually rated their quality of life as better. Similarly, another study involved prisoners who were divided into two groups, one of which was asked to write about the experience of being a prisoner. And those prisoners who did the writing assignment actually rated the quality of their life as happier, which seems a little counterintuitive to me, because chronic illness one could think of as a negative. Prison certainly seems to be a negative. So you would think by concentrating on the negatives of their lives, people might actually rate their happiness as worse, but they don't. And I think that it's this writing from a place of honesty and really examining the circumstances they're in that allows people to feel the joy and the promise of their lives. I just last week added another example in the talk where I read in the Boston Globe that college graduates, they had done a study with graduates who were getting ready to go on job interviews. And again, they divided the graduates into those who wrote a few words about a situation in which they felt powerful. And the other group was not given that writing assignment. And the group of graduates that wrote about feeling powerful performed better on their interviews and had a higher rate of being hired. So just the act of writing is empowering. So I thought I'm going to end with a little reading from the book, but I thought before we did that, if we want to take 2 minutes or 5 minutes and do a little writing exercise together, I wonder if we can prove something similar. So if you have a paper and pencil, or I've seen a lot of laptops, a lot of people have laptops, and come in and sit down. There's plenty of room, two practically empty tables over there and lots of seats up here. I don't want to point you out, but I'm going to give you a prompt. And the prompt is, I want you to think about gratitude, and I want you to either write or dictate or type or work on a communication board and answer the question, or finish the sentence, I should say. Today, I am grateful for. And we'll just take 5 minutes, and then if anybody wants to share either what they've written or how it made them feel, and then I'll do a quick reading and we'll take some questions. So Kelly here has a microphone if anybody wants to share what they've written or share what they've felt when they were writing.
Good morning, everybody. I'm Saroshni Masi. Thought about to be grateful. Today I am grateful to the Lord that I am alive, healthy, and can attend this empowering and meaningful conference. Thank you.
Behind you, Kelly. I'm grateful for that too. I love these conferences. As a mother, I learn something new. As a doctor, I learn something new every year I come.
My name is Alan Demers, and I received my brain injury in 2006, and I am slowly progressing on my road to recovery. And question was. Oh, I'm reading, sorry. See, I've already lost track. Okay. I wrote, today I am grateful for a loving mother who is taking such a deep interest in my rehabilitation, and of course grateful for a loving God who has guided me on this road of recovery. Grateful also for a wife who cares so much for my daughters.
Oh, thank you, Alan.
Alright guys and ladies, I'm Matthew Anderson. I feel grateful that I'm come to this pretty cool hotel here. Is that what it is? With acknowledgement for getting hit by a semi-truck and having a brain injury, and I come here for, yes, I'm grateful for this brain injury conference. Thank you.
So while Kelly's going around, Alan mentioned the road to recovery that he's on, and I remember coming to this conference a few years ago when Marilyn Lash spoke, and one thing she said is that the road to recovery is not linear, and I can attest to that. It's sort of 2 steps forward and a couple to the left and 1 backward and 1 to the right.
Hi, I'm a licensed marriage and family therapist, and I've been practicing for probably 25 to 30 years. And I'm also a survivor. And I just want to comment, react to something that you said regarding the question why. And I was at Kripalu Yoga and Health Center, fairly, not very. Actually, the reason I'm stuttering is not because of the injury, it's because I'm nervous when I'm talking in public.
It's just us.
Just 600 people. And I was really, really grieving and angry, and I went through the labyrinth asking the question, why? And it was really kind of a, why? Why did this happen to me? Why? It was really, really upsetting, of course. And I decided to quiet myself because I was meditating, for those of you who've seen a labyrinth. And I tried to empty my head, as you do when you're meditating, and I let the thoughts come in. And I'm not a religious person, but as I was on my way in, I heard the word kind of booming, because. And I kept walking, and I got to the center of the labyrinth, and the next part of it was, because you are a teacher.
I feel similarly that having experienced this brain injury has set me on this path that I may have been meant to go on. Maybe one more?
Today I am grateful for the gift of writing, to share my thoughts, feelings, to carry the torch that others have brought to me through this journey. I know when I leave this earth, the torch will be passed again. I am grateful for the insight my injury has brought to me.
Well, I think we should finish with that. That was a beautiful metaphor. The carrying a torch and having a torch given to him and him enlightening us with that torch. That was very beautiful. So in the last moments before we either open it up to question and answers or go drink coffee together, I'm going to read a short chapter, and if you've read my book, you'll know they're all short chapters. This one is called The Other Side of the Stretcher, and that's sort of what I mean by that is me learning to have no control as a doctor and just be a mother. And in this section in the book, I have come to the local hospital, and I have not quite learned the extent of Neil's injuries. When Neil was a sophomore in high school, he played Tybalt in Romeo and Juliet. He had few lines, but a formidable stage presence with his fierce anger and menacing bluster. He learned the complicated fight choreography, expertly clashing sword against sword, first with Mercutio, then Romeo. Advancing, retreating, slicing, thrusting, a rhythmic dance. The theater was silent except for the soft shuffle of gliding feet, boots landing on stage in perfect balustrade, swords clanking, first high, then low. And then the death scene. Romeo plunged his dagger deep into Tybalt's chest, Neil's chest, my son. He fell to the ground. Juliet dropped to her knees and cried over him, "Tybalt, my cousin, oh, my brother's only child." "Doesn't that make me your nephew?" Neil would joke during rehearsals, cracking Juliet up every time. But on opening night, he wasn't joking, and Juliet wasn't laughing. She was weeping, and so was I. His fellow actors came on stage and lifted Neil reverently onto a slab of wood, and then covered him with a pure white shroud. They walked slowly, as if marching to a silent dirge. They placed him carefully onto a makeshift bier, 2-foot-high blocks of wood pushed together at the back of the stage. And there he lay for the rest of Act 3. Scene after scene played out. Romeo, Friar Lawrence, Lady Capulet, nurse. Their lines were silent to me, their movements unseen. My eyes were glued to the body at stage rear. Neil's shroud was made of a gauzy fabric. I could see his facial features beneath its flimsy folds. I tried to detect some movement, a breath, a twitch, but there was none. It filled me with sorrow and dread watching my son, dead on stage. The rest of the audience was at a play, but I was at a wake, staring into a coffin and waiting for the victim to rise. "I'm sorry my son keeps killing your son," Hal's mother joked after the performance. We chuckled together, but for months I could not shake the feeling of doom that had enveloped me ever since Neil's onstage demise. And now, 3 years later, an ER nurse was taking me to my boy, and there he was again, my son, behind a curtain, under a shroud, on a bier. But now the stage was an ER cubicle, and the curtain here was stark white, not velvet red. His shroud was a sheet pulled up to his neck, his bier a hospital stretcher. His clothes were lying in piles on the floor around him, cut from his body in haste. I tried to detect some movement, a breath, a twitch. I laid my hand across his forehead, and his eyes fluttered open. "Hi, Mom." He knew me. I felt a rush of relief, but he drifted immediately back into unconsciousness, and my brief elation gave way to a gathering knot of fear. A doctor came in to give me the rundown on my boy. "What happened?" I asked her. "The police are still trying to put it together," she told me. "It looks like a hit and run." I tried to follow her message, to stay focused on what she was telling me, but those words, hit and run, seemed to take over the part of my brain that paid attention. At first she told me his only injury was a broken leg. I lifted the sheet between my thumb and forefinger and peeked underneath while the doctor continued her update. Neil's lower leg was badly deformed, his fractured shin bone strained against his skin at an unnatural angle. The doctor's words drifted back to me. CAT scan, just a precaution, out at the scene. I've talked to hundreds of parents in emergency rooms and ICUs. I've been the bearer of bad news, or at least uncertainty, more times than I care to remember. I know people shut down. I know they can only take in so much. I've learned to slow my pace, to read the signs in patients' eyes and faces that this is enough. The well is full, and I should stop dumping information into it. And now, here I was, on the other side of the stretcher, trying to comprehend what was happening. My son recognized me. That was good. But he slept if you let him. That was bad. I returned to my son's side. There was no chair in Neil's cubicle, so I stood over his stretcher, looking down on his sleeping face. I ran my hands through his long brown waves. His eyes opened sleepily. "Hi, Mom." But he said it as if he were seeing me for the first time. I shivered. A nurse entered and deftly released the brakes on Neil's gurney with her foot and simultaneously swung the bed around and wheeled him out the door and down the hall. She called to me over her shoulder, "You can follow us to CAT scan." I fell in line behind the speeding procession. We passed Trista's cubicle next to Neil's. It was humming with activity. Monitors beeped. Doctors barked orders. Someone was crying. Mary was wailing in the hall outside her daughter's room. I kept my focus on my son. The nurse wheeled him into the radiology suite, motioning toward a couple of lonely plastic chairs in the bare hallway. I took a seat and waited. A faraway jangling sound drew my attention down the long corridor. A uniformed police officer was striding up the hall, his heavy keys bouncing against his leg as he walked. He was escorting my husband to us. Saul broke away from the officer when he spotted me, and I rushed to meet him. My husband is a big man with strong, broad shoulders. He owns his own restaurant supply store, and he's accustomed to moving industrial refrigerators and wrestling 2-ton walk-in coolers into place. But as he raced down the hall to meet me, his arms open to gather me up, his frame was heavy and bent. "He's okay," I blurted out, more because I could see how panicked Saul was than because I believed it was the truth. We fell into each other's arms. "I thought he was dead, Cal," Saul's voice cracked. His face was buried in my neck, muting his words. I tried to console him as best I could. "He's okay," I repeated, trying to convince myself of the truth of the words, even as I spoke them. The scanner door opened and the nurse pushed Neil's stretcher back down the hall toward his room. Saul bit his lip and touched Neil's head as they moved. "Hi, Mom," Neil said, monotone, then closed his eyes again. Saul looked at me with a smile and a sigh of relief. My heart cracked. I felt almost nostalgic for that sense of relief that I too had experienced just moments ago when I realized Neil was alive and knew me. But even though Saul was only minutes after me in responding to our son's accident, I felt like I was light years ahead of him in understanding the magnitude of what was happening, not just because of my medical training, but because Neil was repeating himself. His recognitions were without emotion. He seemed a shell, and the blanker he was, the more I worried about damage to his brain. Our chairs were close to where a group of scrubs huddled in front of a light box and murmured over someone's films. I strained to hear their words over the ambient bustle. Brain, fracture, bleed. I knew they were talking about Neil. When they turned and walked towards us like one organism, I squeezed Saul's hand hard. "Your son has a fractured skull," one of the scrubs explained. "There's a bit of bleeding at the site," added another. "Nothing big, really, but we'd like to transfer him to Boston, in case. In case he needs a Richmond bolt," I thought, an intracranial pressure monitor. My local hospital was not equipped to do brain surgery on a child. I tried to push visions of Neil's shaved and bandaged head out of my mind. While I was grateful he was being transferred to a tertiary trauma center with the best neurosurgeons in the world, I was terrified that he actually might need one of them. I squeezed Saul's hand, trying to interpret the situation for him. "It's just a precaution," I said, hoping this was true. They led us back to Neil's cubicle. He was more agitated now. His leg was hurting. He thought he was in a gym. After each arousal, he fell back into a deep sleep. Saul and I stood over him, our hands on his shoulders, feeling helpless and scared. I swallowed my grief and stroked my boy's hair. There was no dried blood, no broken glass, no evidence of the trauma he'd just been through. I remember thinking, how can he have brain damage when he doesn't even have dirt in his hair? He opened his eyes. "Hi, Mom." So So I think we have some time. I can open it up for questions or comments from anyone.
Hi, can you hear me?
Yes.
Okay. First of all, thank you very, very much for your words of inspiration. My name is Jim Mesmore. I'm a survivor. My injury was from carbon monoxide. And I was a professional writer before my injury. It's taken me years to learn how to walk and talk all over again, but I have been working on my own book. And hearing your story today has given me the impetus to keep going forward. I was at a rifle, if you will. And I just want to thank you for being an ambassador of hope. And I just, especially in the medical field, thank you very, very much. You're just inspiring us.
Well, you're welcome, and thank you. And if I've inspired someone to finish a book, you've just made my day.
Hi, my name is John Tripp, and I'm a survivor. I received my brain injury in 1970, and it went untreated for 40 years. What you've had to say this morning has given me such an insight as to how my family, my mom, must have gone through. Mm-hmm. It dragged my arm in first, then it dragged my head and neck. So the focus, like you said, was on the arm. For 40 years, it was, you'll find, there's nothing, there can't be anything wrong. So I believed them. For 40 years, I believed them until I just got to the point where I couldn't do it anymore. I couldn't work anymore. And I'm just very grateful. You told us we could be grateful for earlier. And I'm just grateful for listening this morning. It's given me an awful lot of insight. And I want to thank you. And I want to thank your son also.
Well, I'm grateful you came.
Hi, I'm Brian, and 33 years ago I suffered a major head injury. It was, because I was an athlete before that, it was 55 times before that I've been knocked unconscious playing sports. And I asked myself that question 33 years ago, why me? And what's the gratefulness here? And what I heard back when I was being silent after my injury was to just open up to the endless positive possibilities and what the upside of an apparently really traumatic and difficult situation. And in 33 years, slow recoveries, using alternative health as well as Western medicines, you know, I'm where I am. But then I had, as a point of emphasis and synchronicity today, just as I came off of 495 to the conference, so it's like an eighth of a mile, half a mile up the road, the woman started pulling out on 495, and I pulled out behind her. She slammed on her brakes, so I had a car accident just like minutes before coming into here.
Oh my
and
God.
I'll tell you, just even though it didn't, you know, wasn't much damage, she might have done something to her neck. It was shocking, and then it re-traumatizes the PTSD stuff, you know. Yeah. And yet to be able to, afterwards, I said, well, boy, this is interesting, and I didn't know that your story was about a car accident. But for me, it just emphasizes the point of endless positive possibilities and to wonder why something would happen like this and right away move into a gratitude process of how do I work the upside of a situation, and not deal with the obvious downsides. Yeah. So thank you for being here and sharing your story, which helps me reflect.
Well, the first time I heard that word, synchronicity, Julia Cameron, are you familiar with her? She wrote a book called The Artist's Way, and that may have been when I first started writing, but it's a great book. She talks about synchronicity as kind of just looking in the world around you and receiving messages and the things that you need.
I think Carl Jung coined it, actually.
Hi, my name is Barry Rothstein. I'm a rehab doctor for brain injury. When I'm speaking with families, especially early on, It's often difficult to gauge exactly how much information to give, balancing hope with reality. And often we have a gigantic, we don't have great prognosticators, so we don't really know. I do try to read the family member I'm talking to, try to get an idea, am I overloading them, do they want a lot of information, etc. But I wonder if, as a physician as well as a parent of a survivor, in particular advice around how to engage that conversation and make it best for the family.
Yeah. Well, I would say one thing, not to say, one thing that was said to us when we were in Boston, it was said to us by the emergency room physician is, your son's going to be just fine. He's going to be just fine. And I could see already that he wasn't going to be just fine. And as I outlined all that he's been struggling with for 10 years, that really was not our experience. But I would say what you're doing sounds right on, that people definitely want hope, but people also want you to be realistic with them about their expectations. And that's, I struggle with the same thing. I'm in a primary care office, and we have, now with the new Massachusetts concussion guidelines, we're having to clear athletes when they go back. And so I'm seeing a lot more kids with concussions and, you know, trying to help them to, yes, be optimistic, this will pass, but to leave them with something to look for, too. These are the kinds of things I want you to watch for. But it sounds to me like you're doing just fine, Barry.
Hi, I'm Laura, and I'm a nurse. I worked at Beth Israel in the trauma ICU for about 16 years.
I was a nurse for many years, too.
And I could say one of the things that I used to say to people is, it's kind of like being thrown into the middle of a movie. Your old life is back there, you don't know how you got to the movie. You're in the movie, you can't get out of the movie. You meet a lot of great people, some bad people. And that, unfortunately, your life will change. It's different now. But just kind of saying to them, because they're seeing so many people initially, that it's like being thrown into a movie. You just have to kind of go with it for as long as it lasts.
Yeah, yeah. Yeah, I think that's a nice metaphor too, and just that you don't really know. You don't know what the future is. You can't. You can predict somewhat, but certainly not specifically.
Thank you. My name is Deborah, and I thank you for being here very much. First of all, I'm a nurse, and I'm also, more importantly, the mother of a brain-injured child who is now 32, who 7.5 years ago was injured by a motorcycle accident, who I can totally agree with you when you say your life stopped just like that. My son was with me. We were redoing the outside of our home, and he left me, and 7.5 minutes later, a police officer was at my house saying that I needed to get to the emergency room because my son's heart had stopped because a truck had hit him, pulled in front of him on his motorcycle, and he had arrested. He was, they didn't even wait for med flight to take him to Brigham Women's Hospital, and he had severe traumatic brain injury. Since then, he did survive. He wasn't supposed to, but he's had 26 surgeries. When he left the Brigham Women's Hospital 7 weeks after being in the ICU, he went to Spalding and spent 7 months there. And I quit my job and brought him home. He wasn't supposed to walk or talk, and he is now driving a truck. He's not able to work because of his memory loss. So there is hope. There is hope for brain injury survivors. As long as they have somebody that loves them, there is hope. So never give up on a brain injury survivor. But I can tell you that a mother's love is the strongest, and I thank you for saying what you said today. I definitely appreciate what you said today, and I will read your book.
Ah, thank you.
Thank you very much.
Yeah, I'd like to reiterate that there is always hope, and years can go by and you're still making progress. It's not that after this many years, that's what you're going to get. You can get a lot more. It's true. Coffee, anyone? Thank you.